Hey Care2, it's Heather, and I am sitting next to Jeanne Rizzo, who is registered nurse and the president of the Breast Cancer Fund, who we have done a ton of work with over the years, and we're proud to be able to take a couple minutes to sit down with her today and talk about some of the stuff that Breast Cancer Fund is working on. So Jeanne, I actually wanted you to start out by talking to the Care2 audience a little bit about your organization and sort of the way that you approach these issues. There's a lot of organizations working on breast cancer, obviously, and we all know about sort of the pink ribbons and the races and all that kind of stuff. You guys are approaching this issue a little bit differently. Talk about where you sort of fit in this bigger picture.
We know today that it is an epidemic. 250,000 women will hear every year that they have breast cancer. 180 or 90,000 of them, it will be invasive breast cancer. 40,000 women will die of breast cancer every single year. And less than 1 in 10 of those women have a genetic history of the disease. When you put all the known risk factors together for breast cancer, we still can't explain more than half of breast cancer. But set the pie chart aside. Rather than just look at the numbers, look at the lives that are affected by this, and that we have invested little if nothing in primary prevention of breast cancer. And what the Breast Cancer Fund's role in the movement is, about 10 years ago or so, we started to ask the question, is there science that points us to environmental causes of breast cancer? Mm-hmm. And so we issue a report every couple of years called State of the Evidence, which aggregates the existing science that tells us indeed there is a connection between toxic chemicals and unnecessary exposures to radiation that are contributing to the increase of breast cancer in this country and in the world. And that's where we focus. We said, yes, access to care and treatment are important. Certainly we want to screen people for breast cancer, but that doesn't prevent anyone from getting it. Mm-hmm. We wanted to go upstream and say, how can we identify those things that are contributing to breast cancer, and how can we intervene to reduce those exposures? So that's what we do, and that sets us apart in the movement.
And how long has Breast Cancer Fund been around?
Breast Cancer Fund has been around since 1992, and our mission has been the environmental health mission since 2002.
Great. So in the context of your mission, you actually had a recent victory in the last year. And I am going to pronounce this right. Phthalates.
Absolutely.
You were a part of the fight to ban phthalates. And in fact, many Care2 members actually, tens of thousands of you signed petitions. Many of you will think about phthalates in the context of toxic toys. So talk to us a little bit about that battle, because it was very interesting for me to read about how that sort of all came together.
Well, I think what you have to understand about phthalates is that they're a class of chemicals that disrupt the body's hormonal system. They trick it, and they actually are linked very closely to early puberty, to early onset puberty, which is also linked to a higher risk of breast cancer, and they're linked directly to this disruption of the hormonal system that we understand to be a contributing factor to increased breast cancer. So we began to look at where are phthalates. Phthalates are ubiquitous. They're in so many plastic items. We use them all day, every day in our lives. But we began to look at where are they present in a way that will capture the public's attention, and that the exposure is to a very vulnerable population, and that's children. And we understood that phthalates were in children's toys, which was a pretty horrendous discovery. They're in the toys that they make toys chewable. They make them softer in some instances, okay? Right. And we realized that the European Union had banned 6 particular phthalates from children's toys, but they were not banned in US toys. Now, most toys in this country are made in China. About 95% of the toys are actually made in China, and they're imported here. And there are 2 sets of factories there. One that make the toys without the phthalates for the European Union, and then you have the toys that are made and imported back into this country that have these 6 terrible chemicals in it.
Was it because they were cheaper, or to manufacture, I mean, with those chemicals in them?
It is cheaper, and we also export. We export to China one of the phthalates that is a byproduct of of oil production in this country, in Texas, for example. So we're exporting DIMP to China, which is being put in the products. That's one of the phthalates, and I won't bore you with the names of all the phthalates. Well, we worked on a piece of legislation in California to ban phthalates from children's toys and began to work with other states about that. Senator Feinstein, who's of course our California senator, was introducing and working on the Consumer Product Safety Act in Congress. Heard about the phthalates ban in California, picked up the phone and said, I want to add this. I want to introduce the phthalate ban on the federal government level. We were surprised that it happened that fast, and we amended with her. We helped write the bill and worked with Senator Feinstein to amend the Consumer Product Safety Act to include a ban on these 6 phthalates. Now, 3 of them, there was very strong and absolute science about. It was very indisputable. 3 of them there was enough scientific evidence that we felt a precautionary and protective approach needed to be taken. When those 6 phthalates were banned in this federal legislation, it marked the first time that the federal government had taken a precautionary approach to any group of chemicals and basically said, those 3, you come back and prove they're safe if you want them back in the toys.
It totally flipped the
It flipped the paradigm. It was the first time that we had the burden of proof shifted back. Well, once they're banned, they've got to stop making them. And they can stop making it that way. We certainly don't expect them to come back and ask it to be reversed. They've had to completely change their manufacturing process. So it was a huge success. The Toxic Toys legislation really marked the Breast Cancer Fund's very strong position in Washington, D.C. And we turned that bill around in 5 months.
Can you talk about the phthalates as a model, and this maybe is part of the context for why it was such a battle, but in terms of your agenda going forward?
Well, when you think about where do you start, you could start with there's a number of classes of chemicals. We looked at what chemicals are going to resonate with the public, what products are going to resonate with the public, because we need public support for that. We needed all those Care2 letters to come in. We needed the emails from the Moms Rising group to come in. We needed people to mobilize around this. So when you look at something that's really discretionary, not that toys are in the category where you can make some choices about what you give your kid. So it's a discretionary product. It's primarily marketed to women. The purchasers of those toys are primarily women. The same with personal care products. Discretionary, even though they seem vital and essential, they're marketed to women. And often these products are also marketed under a cause rubric, right? Where you've got something where they're raising money for breast cancer or some other important cause. So you have a consumer concern when that happens that, wait a minute, this isn't okay with me. So we looked at those markets that were targeting women, that were targeting children, where the chemicals were totally discretionary and could be replaced, that there were safer alternatives. So yes, toxic toys is one, personal care products is another, toxic chemicals in baby bottles. Moms don't want to feed their kid formula in baby bottles that have toxic chemicals in them, those kinds of things. So it's to open the door for major chemicals policy reform in this country.
How can Care2 members help promote the mission of Breast Cancer Fund? What are the ways in which they can sort of take action and get active on the kinds of issues you're working on to make a difference?
I think the Care2 audience is so closely aligned with our values and our core mission, which is a vision of the world in which people don't live in fear of losing their lives or their breast to breast cancer. I don't think anyone who's a member of Care2 wouldn't share that value and wouldn't be interested, as they have friends, neighbors, family members who've been through breast cancer, to say, I'm interested and willing to take a look at the information. I'm willing to learn more. If all people did was access the information and change a little bit of their daily lives and have a conversation about it, I'd really be very satisfied with that.
Jeanne Rizzo, Breast Cancer Fund President, thanks for your time.
Thank you so much, Heather, and thank all of you.